Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Carole Fisher, President of National Partnership for Healthcare and Hospice Innovation. Thank you so much for joining us, Carole.
Oh my gosh, Millicent, thank you for having me as a guest. I'm really excited to have this important conversation with you today.
You know, one of the things that we try so intentionally at Four Seasons is to make sure that the community feels like they have resources that otherwise they may not know where to turn to. And so the purpose of our podcast today, we'd like to learn a little bit more about how national partnership with NPHI helps not only us as an organization, but them as a member of the community. So to get started today, would you tell our listeners a little bit about your background and your passion for high quality care for those with serious or even life-limiting illness?
Yeah, you know, my background is actually in social work. I started my career as a social worker many, many years ago. And I've worked in a variety of roles in behavioral health care. I work for an insurance company. I've done a variety of things, but I spent 14 years at the helm of Nathan Adelson Hospice. I had the privilege of being their president and CEO, and it was a reminder that I have a passion for having a purpose, and that was just a really fulfilling role. When I left Nathan Adelson Hospice, I went out to seek new opportunities, and I had the good fortune of working, being a member of NPHI, but working closely with Tom Gazumpis, who is our founder and CEO. And he asked me to join the team, and it was there soon after that he put me in the role of president for NPHI. And it's just been an honor to work on a national level and help shape some of the work that I did at Nathan Adelson Hospice and bring it on a larger platform. So yeah, that's a little bit about me, and it's just we're having fun each and every day helping our members.
I love so much that you have been a social worker and a CEO of a hospice yourself, because I think for the community to know that you're a person who genuinely cares about local communities as well as communities throughout the entire U.S. That's really helpful when they think about, hey, who's leading on a national level advocacy and research and support for the very important work of serious illness and end-of-life care. And so when we think about how valuable of a partner NPHI is and the resource that you and your team are for Four Seasons and so many nonprofits throughout the nation, could you tell our listeners more about the mission of NPHI and connect possibly with how NPHI also supports individuals in the local community?
Well, as I mentioned, Tom had this vision, and he had a vision that we were stronger together. Yeah. And that together we could really tell a story and tell that story on a national platform. So our members, I think we're up to like 115, Millicent. Our members are the safety net. It's incredible. They're the safety net, community-owned, mission-driven, not-for-profit members in their community. And, you know, they really work each and every day to make sure that people just die well. So I want to give a shout out to our members, because it's pretty incredible that each and every day, 55,000, give or take, are being helped on a daily basis. If you look at that each year, close to 1 million patients that our members collectively are caring for and employing 35,000 people. Wow. It's just incredible. And then, of course, you know, the importance of volunteers at the bedside and working in organizations. So there's, close to 27,000 volunteers collectively. Isn't that amazing?
It's huge. And to think about people in their local communities care about making access to high quality care possible, whether it's working, volunteering, referring, donating, you know, whatever the involvement may be, it matters. And to think about how many people are involved, it's pretty tremendous.
Yeah, it's tremendous. And so when you talk about, how can folks in their local communities not just
Yes.
receive help, but they can also provide help. And so that's one of the wonderful things about NPHI being really a convener of the resources that are available throughout the country.
One of the things that you said made me think about, as a listener, they may be wondering, like, okay, so NPHI works with and supports nonprofit organizations. What are some examples of some efforts that NPHI is kind of ongoing in support of members on? Because I think that could also connect with listeners. And that what stands out to me is assurance of quality care. But anything that comes to your mind that you think would be beneficial for our listeners to hear about, NPHI really works closely with members in these areas.
Yeah, I love that you mentioned quality. I think we're at a time right now where there's growing frustration with America's healthcare system.
Mm-hmm.
We're seeing a real consumer backlash with the death of a horrific death of the CEO of United. And,
So sad.
people are wanting to own their health care in a way where they're respected,
Mm-hmm.
where they don't ever feel denied, where they're not paying astronomical fees for care. And so when we look at our members, I'm so proud to say that our members care for the most vulnerable, just like your
Yes.
organization, Millicent, the most vulnerable, the most needy, and you never discriminate who you're caring for. You're always, and along with all of our members across the country, and I should mention we have one in UK now.
Oh, wow.
But we're just say yes organizations,
that's it.
and that's what's so important. So we're helping our members with that. We're driving advocacy in Washington, D.C. That leads to policy changes that ultimately will benefit our members and the patients that they care for, the patients and families that they care for. We also spend a lot of time providing resources. We do that in a couple different ways. We have collective meetings where we share best practices, and our members have an opportunity to talk with one another. We bring in outside speakers. I think our work in the Innovations Lab is really important to highlight.
Yes.
I know that you use some of our resources and our tools, but we've created patient, caregiver, and clinical guides under the leadership of Dr. Cameron Muir, who's just a brilliant physician. So we have very specific resources for persons experiencing lung issues or cardiac issues, or cancer issues, dementia. So
veterans,
there's a whole list of resources that we have.
So many tremendous resources. You're right. One thing that I love so much about that is it's a commitment at the NPHI national level as well as at the organization level to provide the very best access to care possible. And so resources help make that possible. Helps to train the staff by having materials. It helps to connect with the community to make sure that they have an awareness of what's available. And I just appreciate the support, because we realize that every individual who is facing or has a loved one facing a serious illness or end of life need, they need support. They need quality care, and they need that confidence to know that they are being well served. And when I think about being well served, we are just getting ready to enter 2025, and some listeners may be listening in 2025. And so when we think about issues that you're seeing on the horizon for palliative and hospice care, I wonder if there's a few issues that come to your mind. Certainly, recently I was doing research to present to a couple of groups, and one of the common trends was that people are growingly having a need, and rightfully so, to be involved and aware of what's going on with their health care. And they want to have a voice and be a part. And so that's something that certainly we prioritize, that whole person care. And the most involved people, whoever is important in their life, engaging them in provision of care. But we also know that there's more that we need to be aware of and ready for. So are there a couple of issues that you would say are on the horizon?
Well, I love that you talk about patient-centered care.
Yes.
And everyone should have the choice of how they want to spend their final chapters in life. And embrace the loved ones and caregivers along the way. And so our members really do that. And I see that strengthening as we move into 2025. But I also see us paying attention to fraud and abuse, which is running rampant right now, as you know. And
so sad.
There's a continued need to really strengthen and protect our members and make sure that the patients that they care for aren't compromised in their care. So there's a lot of rising audit pressures because of this tremendous growth.
Huge
and
amount
an
of
emphasis
growth
on profiteering on people at end of life. It's created a large distraction for our members. And you know firsthand, you really have to pay attention to making sure that you're dotting the I's and crossing the T's. So I see us continuing to move forward with that. I think the other thing I'd mention too, Millicent, is getting ready for value-based payment models.
Yes.
We're watching the entire healthcare system shift, making sure that quality is first and foremost. And we're going to continue to help our members focus on those quality outcomes.
And when you think about the focus on quality that actually has been, and always has been, but in particular in 24, that was our word of focus for our organization. And as we enter 2025, we're continuing that commitment through having a positive, consistent impact in the lives of others. And so, like what you said, whether it's fraud and abuse or the rise of audits to ensure the quality care is being provided, the good thing that we know at Four Seasons is that everything we do is so that lives can be positively impacted. And so we learn about changes and we make sure that we are equipped as proactively as possible. And being a part of NPHI helps us to learn early on before something is like a change is upon us, because we genuinely believe that in order to fulfill our mission of co-creating the care experience, we have to be aware of what's coming so we can be really in tune to be equipped and then listen to those that we provide care for. And so thank you for that. And, another question that comes to my mind is what we're already talking about it, but it's how NPHI helps nonprofits like Four Seasons focus on the patient, on quality patient care instead of the bottom line. Could you share a little bit more about that?
I think it comes organically with our members because there's this unwavering commitment to ensure that patients and families have what they need at all stages of life. And so it's an easy lift for NPHI to just emphasize and help folks. When you're running a not-for-profit organization like you are, there's a strong balance of strong business acumen with balancing the heart and soul of everything that you do throughout your organization. So in our role as a convener, as a supportive entity, we're looking to help you strengthen best practices. Yes. We're looking to help you strengthen your messaging in your local communities. Always reminding folks what it means to be a high-quality care provider. Really teasing that out because we know what that means. Yes. But I think that there's opportunities to really talk about in stories about the wonderful work that's provided by your organization and our other 100+ members. They're very unique. And so, really making sure that we're articulating those stories well on your behalf is really important.
I love what you're mentioning about stories, and that actually makes me think about one of the benefits and necessities that we identified was that as we're learning about the needs of our community, and we've been learning about it since 1979, but is that we make access to care possible regardless of someone's ability to pay. And so at Four Seasons, like many nonprofit organizations, there are incredibly generous donors who say, I want to make sure that people have access to the palliative care, the hospice care, the grief support, the veterans honor, whatever it may be. that they deserve. And so when I think about that, there's also a need for continued awareness, advocacy, and alignment or preparation or learning, if you will, around how the care we provide can continue to be even better. And so you may already be aware of this, but a few months ago, we had Chris Como, who is the president and CEO of Telehouse Cooperative Network, on our podcast. And one of the topics that we talked about is why Four Seasons community, all the communities we serve, can be confident with us being a part of a clinically integrated network. And one of our commitments to high quality care is making sure that we're looking at results, that we're listening to feedback from our patients and their most involved person, that we genuinely take the time to say, hey, what's most important to you and how can we provide better care? And so there's metrics that we track to make sure we are co-creating. And by doing so, being a part of the clinically integrated network, we're able to best position Four Seasons to be as accessible as possible for other individuals as well, who maybe they have another form of payment, another type of insurance. And so when we think about our continued commitment, that's one thing that I always like to remind the community is that we genuinely care and we want to make care possible. And so, like you said, we are a yes organization. You call us whether you understand which service you need or not. You just simply call us. We genuinely care. And so when we're a part of NPHI or TCN or in a CIN where we say, hey, how can we be providing even better care? What's coming that we need to look at? That is another way that we're saying and adhering to our commitment to the community. When we think about our commitment to the community, my final question is, there are so many benefits to receiving care from a nonprofit palliative and hospice organization. I'd love if you would be willing to share a couple of the benefits that come to your mind.
Oh my gosh, they're unlimited.
Yes.
Not-for-profit, we did research, we commissioned research a few years ago, and what we learned is that mission-driven, our members,
Yes.
mission-driven organizations like yours provide 10% more nursing visits. I mean, that's significant.
That's so significant.
35% more social worker visits. And I don't want to say that there's anything wrong with a for-profit
Right.
organization. I want to be clear about that. There's some
Absolutely.
excellent providers of for-profit care.
Some absolutely wonderful ones, yes.
One, though, of the differences that I see is that each and every day, our mission-driven members are getting up, making sure that first and foremost, they're improving the life at the end of life.
Yes.
And that's the focus, not on necessarily the bottom line. And you see that in these results. Your organizations, our members, are spending 2 times more on bereavement services than organizations that are really organizing their business model for profit. So there's nothing wrong with making a little profit. I mean, we don't want you going an under here. We want you to be fiscally responsible and a solvent and strong organization.
Well, and I'm glad you said that because that's important so that we can make care possible if someone doesn't have access to it or expand a service. Invest in the lives of those in our community, whether it's our employees or it's the patients needing a certain type of support. So I agree that's so important.
Yeah, and I'm just in awe of the tremendous work that you and our other members do and the commitment to making sure that the care is special, that it's individualized, and the stories are just endless, whether it's helping someone who's at the end of life, making sure they can attend a wedding or they can pet their horse one last time. Or, I mean, the stories are endless. And so you're doing remarkable work. And I know as we move into the new year, we're looking forward to continue to strengthen our voice on the Hill, to strengthen our voice in our local communities and make sure that people understand that they do have a choice when it comes to who can help them. And that there is no better care at the end of life than choosing a not-for-profit, community-owned safety net provider in the local community.
I'm so thankful that you said that. You know, I was thinking about a story. Over the past year, there was an individual we served, and that individual's family, after they had passed away, said, I wish they had received care sooner. And how sad is that to think that there are individuals who may go without care or less care. And so that's something that, with what you were just saying, it made me really connect with why we do what we do. We care about every single person, and we want to make sure they have access to the care as soon as they need it. And in fact, this story goes on to say, you know, even though my loved one only received care for an incredibly short time, your team still made possible something that they didn't ever expect. And you know what that was? That's something that NPHI has developed a pretty tremendous tool on, and we're really proud. It's our We Honor Veterans program. And that individual, before they passed away, they were able to be honored through a special pinning. And even though there was only a few hours left for that person to be alive, it meant significant to them and to their family. And so whatever it might be that our listeners are thinking about right now of, you know, I do have a loved one, but they're scared. We're scared. Just know that we want and we will commit to providing comfort, compassion, and confidence. All you have to do is call us, and we genuinely care about where you are and what you need. And I'm so grateful to be able to collaborate with an organization like NPHI so we can continue to learn and be available proactively to provide the very best care. So for our listeners, thank you for trusting Four Seasons, the care you trust. Thank you for calling us. And we don't want you to have to suffer alone. Know that we are here and you can call us anytime. So Carole, thank you so much for advancing high quality care throughout the nation for palliative and hospice. And thank you for being with me today.
Oh, thank you. And Millicent, I got chills when you shared the story about the veteran patient, and you know, who deserves more respect than someone who served us and protected our country.
You're right.
So thank you for the work that you do for your team, just an amazing team at Four Seasons, and your volunteers, and just keep up the incredible work, and I look forward to collaborating with you as we move forward in the new year.
Oh, thank you so much, Carole. I feel the exact same way. So listeners, for more information about our services, please visit us at fourseasonscare.org. We care about you, and we look forward to providing the very best trusted care.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.